Welcome to the Cabral Concept, where board-certified Doctor of Naturopathy, Dr. Stephen Cabral, shares with you exactly how you can reverse aging, take back your health, and live a life full of energy and passion, with new 20-minute episodes every single day to keep you healthy and engaged. Now, here's your host, Dr. Stephen Cabral.
Welcome back, everybody. Brand new Cabral Concept here today. I want to make sure that you've heard of this. It is not new, but it is a specific disorder that greatly affects people that may be suffering with ADD, ADHD, depression, alcoholism, schizophrenia, Aspergers, autism, Tourettes, depression, and many more. And I would even put in there obsessive compulsive disorder. So how does this affect so many people with specific, let's call it mind-body based imbalances? Well, it's called parole disorder or cryptoparolia. And why it matters so much is that it's almost never picked up by conventional medicine. Almost never will your doctor or psychiatrist pick this up. And it actually has a fairly simple fix that we've used many times in our practice before. I personally was not aware of it until around 2012, 2013. And then we started to look at it more in our practice. And so much so that we actually got rid of all the lab testing that we used to do for it. Even though it's a simple urine-based test, we actually got rid of it because the fix is much more simple. And I want to share that with you here today. It's simpler and it's less expensive. Okay, so let's get right into it. What is parole disorder or parole disorder? It's just Pyrrole. And it's also known as paroluria or cryptoparoluria. And it's a genetic-based disorder, maybe, right? Maybe, because it can also be caused by environmental toxins, stress, or antibiotic use. So nobody really knows. Conventional medicine doesn't know for sure. We see it show up much more in gut-based disorders. And so it very well, it may likely simply be genetic from the standpoint, well, I don't know about genetic, but you may have been born with not exactly the best balance of intestinal flora, intestinal bacteria. Or you took antibiotics, or you were exposed to high amounts of glyphosate, eating Cheerios or all these certain types of, so-called kids' foods. And it led to maybe a gut-based imbalance. And now it's not going to affect everybody, okay? So I just want to be clear on that. But at least people who are more predisposed, it can certainly affect them. And what happens is parole is a byproduct of hemoglobin synthesis and has no known function necessarily in the body, but it's a byproduct of essentially oxygenation of your red blood cells. Now, most people, let's just go with 99+% of people, because this doesn't even affect 1% of people, but it still affects a lot of people. We're talking about millions of people around the world. So here's the issue, though, is that not everybody's affected by this, but the people that are absolutely show up with the symptoms that I just spoke about ADD, ADHD, depression, drug addictions or alcoholism, schizophrenia, Aspergers, autism, Tourettes, let's say even postnatal-based depression. I think that's an important one to look at as well, and many others. On a lower level, this is how I see it show up in practice. People that are they have a lot more extremes in terms of nervousness, irritability, depression, maybe short-term memory loss, some anxiety, or they have like explosive anger and rage. Those are the people that I look for specifically. And again, one that often gets left off the list is obsessive compulsive disorder. And it's interesting because when I ask people, about a lot of these things, irritability, depression, nervousness, and OCD, and they'll say, well, some days it's stronger than others. And it's very fascinating because this is why we don't always do the cryptoparolia testing as much anymore, because some days it'll be stronger than others. And some days there's more a parole-based byproduct from the hemoglobin-based synthesis, just the red blood cell oxygenation-based synthesis. And so, again, we used to do a simple urine test. You can still have it done if you want to. And then what you do is you look for a range. So on some of the tests, basically 0 to 10 is fine. 10 to 20 is moderate for paroluria, and above 20 would be quite elevated. But I've seen this affect people even like at a 13 or 14, in the moderately affected. And so here's what we do, and this is really important. The number one thing that you want to look for, and this was a game changer for me, and it's so strange because I know people are talking about it more now, which is great, but back in the day when I was trying to heal from like 96 to 2006, I know it was like the beginning of the internet around 2000 or so, and people just started to get on it, and so did I. But still, the information sharing wasn't that great, especially in natural health. But these were game changers for me. And it was vitamin B6 and it was zinc. And a lot of people don't know this, but if you're dealing with irritability or depression or low mood or mood swings or anything like that, honestly, any mood based, and I can't provide you with any medical advice, medical cures, medical diagnosis, or medical treatment plans, but you would be shocked as to how life-changing it can be to get not just vitamin B6, but a whole activated B complex. But it needs to be 25 to 50 milligrams for most people of P5P, or there's multiple forms of B6, but we use multiple forms just based on absorption. And it can have a marked difference in a matter of days to weeks, along with zinc. There's also many great forms of zinc picolinate, zinc citrate, etc. And what I found with myself is that I do best with around 25 to a maximum really of 50 milligrams of B6 a day. I use daily nutritional support, and then I use typically one activated B complex at lunch. And then for zinc, the recommendation is just 15 milligrams a day. I'm someone who does much better with closer to the 35 to 50 milligrams of zinc per day. Part of it's body type, part of it's genetic predispositions, part of it's the weakened immunity that I suffered over, from 17 years old to 27 years old. But they're game changers for me. They really are, in terms of my mood and in terms of my energy and in terms of my immune system. So those are the first two that we look at, but not just, again, every psychiatrist, therapist, and health practitioner should be looking at nutrient deficiencies whenever someone comes in for depression, nervousness, irritability, overwhelm. And it's not the only places, but we need to look there, and obsessive compulsive disorder. I definitely trended more towards OCD. There's no doubt about it, in my teens and 20s until I figured this out. It really, honestly. And I would have great days and I would have bad days. And sometimes you're just way more depleted of your B vitamins and zinc. But here's what else I want to share with you, because I work with a mother and son the other day. I work with one deep dive client per week. These are very long appointments where literally I do an intensive with them. They're 3 hours long, and I do about 2 to 3 hours of prep work looking at all of their labs, and I go through their whole health history. I go through blood work. I go through all of the at-home functional medicine lab testing, all of it. And the problem is that everyone, I shouldn't say everyone, this is a exaggeration, but we've been taught by the media, we've been taught by, our culture that there's one medication, or if we move towards green medicine, there's one nutrient that we're missing that's going to solve everything. And it's just not the case. It's not the case. So I don't find myself as often having to do this because, truthfully, most people listen to the Cabral concept, they've read the Rainbow Effect, they've, listened to other shows, etc. And so they kind of get that there's a foundational based approach. But even with this, I wouldn't say, even though zinc and B6 are most implicated with Parola disorder, you also want to look at, are you getting all of your B vitamins? So your methyl donors, TMG, methylfolate, which is just vitamin B9, B12, and I wouldn't even just stop there. I'd look at vitamin B3, right? Niacin, pantothenic acid, B5. So these are very important. So I always recommend a full activated B complex. Daily nutritional support or your daily activated multivitamin will have it by Equilife. You can find other brands as well. It's not the only brand, but it's the one obviously I use in my practice. And then most people need a good omega-3. So if you're dealing with a mood-based issue, please look at a good omega-3. And then besides that, vitamin D3 to optimize your vitamin D3 levels, and zinc. So that's where we start, okay? If you can, that was 4, right? So daily nutritional support or daily activated multi, you don't need to do both. Then you're going with, because you're getting all your B vitamins in those, your activated ones. Then you're going with omega-3, then you're going vitamin D, and then you're going with your zinc, your FM zinc or balanced zinc. So absolutely, that is where I recommend starting. Now, there's a few others, and these are already going to be. So these are already going to be in your activated multi or your daily nutritional support or your favorite company, right? You're just going to look for these. Manganese. Manganese is also depleted, especially for those, maybe even taking higher doses of zinc. So a lot of people go too high a dose on one particular nutrient, not knowing, because their doctor or practitioner never taught them, that when you give a high dose of something, it can begin to deplete the other thing, right? So that's why you want to take everything together. You really do. Then you can add on a little bit extra. So for me, again, I take the daily nutritional support. I take an extra activated B complex at lunch. Some people need an extra one at dinner, but I don't. That's the amount that works for me. I've kind of figured out my body after a number of years. And then, yes, I take the zinc. I take that with dinner. There's a little bit in the DNS earlier in the day. Vitamin C, okay, that's a big one as well. It helps with the adrenals. It helps with the overall antioxidant free radicals in the body. So I take extra vitamin C. I like both alkalizing vitamin C and full spectrum vitamin C. So big fan of those. To keep it simple, I often just take the DNS, which has 400 milligrams of vitamin C. Then I get another 400 with my full spectrum at lunch. Then I get another 400 with dinner. And that's the minimum that I'll take. And then I'll often take more than that. Okay, magnesium. This is a big one. Yes, you get some in your activated multi or DNS, but many people with stress or mood or emotional based imbalances need more magnesium. They need to calm the sympathetic nervous system. So we typically do 1 full spectrum at lunch and 2 at dinner. Again, you do what's best for you based on your results, but I'm just letting you know, and this is not everything we do, because we also often use CalMag, which is calcium magnesium, and then we use calming magnesium before bed, which is just simply a powder-based one to help also with sleep and to relax the bowels so that you can have a good bowel movement the next morning. No, it's not a laxative, but just to relax them. Okay, and the last one I spoke about as well, if you're dealing with depression or any mood-based disorder and you're not using vitamin B3, I just think, even for a practitioner, it's a mistake just because of how well studied it is. And you don't need to use a flush-based form of niacin. You can use a niacinamide or another form that's going to be flush-free. That's what we have inside of the daily nutritional support, the daily activated multi, and it also helps with serotonin production. That's why these things are so important as well. So again, use your favorite brand, but I'm just sharing with you that regardless of whether you test for this, most people won't, because the fix is literally B vitamins and zinc. Add a little bit of magnesium if you can. And what does it do? Well, it helps remove these paroles, these P-rolls from the body, meaning like they float around in the bloodstream. They're difficult to excrete with certain people with this particular imbalance, but by giving the body a little bit more zinc and a little bit more B6 or all of the B vitamins, you're going to be able to excrete them to a greater degree. So again, this can be a game changer for very little money. You can test this for 4 weeks, start to see if you get improvements. You know that I'm a huge advocate of at-home lab testing to actually look at what's going on in the gut, right? Is there candida overgrowth, parasites, SIBO or H. pylori, and you can test those, or food sensitivities with the big 3. So all of these things are available. I just recommend spending a little time, peruse, look for more free podcasts at stephencabral.com/podcasts, or head on over to stephencabral.com/shop to find out all the different lab testing and all the different products we use in our practice. They are game changers. It's helping hundreds of thousands of people a year that we work with, and I just want to make sure that you get the same results, or at least you know what to bring up working with your practitioner as well. Thank you so much for tuning into the show. I will be back tomorrow with a brand new Cabral concept. Take care, everybody. Are you ready to heal yourself and then go on to heal others? If so, the Integrative Health Practitioner Institute can help you discover proven functional medicine protocols that blend the best of 7 different healing disciplines from around the world. I personally share with you the exact handouts and protocols I use in my private practice that enable people to get well, lose the weight, and live longer, stronger. I want to pass this information on to the next generation of health coaches, and that is exactly why I created IHP. We are the future of the health coaching industry, and the skills and knowledge you will learn will make you an in-demand certified health coach anywhere in the world. Although we have many medical professionals taking the IHP certifications, no experience is necessary, and half our members have no previous health certifications. At the Integrative Health Practitioner Institute, our motto is a health coach in every home. Our goal is that you take this knowledge and then share it with family, friends, loved ones, your community, or in a practice where you create a career you love and can be proud of. The global IHP community is filled with some of the most kind and caring people in the world, and we can't wait to welcome you into our world soon. For more information or to set up a discovery call with one of our IHP Health Coach graduates, simply head over to integrativehealthpractitioner.org.